name is Clarissa Silva, and I did my project on Ireland. Ireland was established in 988. It sits in the Atlantic Ocean, right near the United Kingdom. It is part of the European Union. Ireland has a very strong and impressive healthcare system. This can be seen when analyzing its accomplishments in regard to infant and neonatal mortality rates. Through my analysis, I saw that the most significant change has been seen in the less than 5 mortality rate. As you can see from the graph below, during the 1960s the rate was high. Since then it has started to decline and it is almost near zero. The change is significant and has been sustained. The sustainment can be attributed to public health initiatives. Ireland has a very strong public health care system, which strives for community outreach, education, and awareness. Secondly, it can be attributed to health care expansion. Ireland strives to keep all citizens insured, regardless of economic status. Lastly, the change can be attributed to healthcare analysis. Because of a strong public health care system, analyses are conducted yearly, and solutions are implemented as necessary. Being a part of the European Union, Ireland's healthcare system strives for adequacy, excellence, and efficiency. When conducting my country comparison, I was slightly concerned that Ireland would not rank well among other countries. France, being a part of the European Union, has one of the best health systems in the world, as does the United Kingdom and Germany. Still, when conducting a comparison of infant mortality rates, the United Kingdom, when compared to Ireland, had much higher infant mortality rates. This can be seen in the graph above. During my second analysis of fertility rates, Germany, in regard to Ireland, had much lower fertility rates. The difference between the two countries can be attributed to many different things. In regard to the fertility rate, Ireland has a very strong Catholic foundation. Abortion is not practiced and there is a lack of contraceptive use. Within regard to infant mortality, the United Kingdom has many issues with determinants. Women over 40 and less than 20 had increased risks of stillborn births, babies born with congenital anomalies, and low birth weights. This then has an increase in infant mortality rates. There is also a socioeconomic status disparity. Women in the United Kingdom of lower socioeconomic status had an increased risk of infant mortality. Lastly, there is a reporting disparity. In Ireland, a baby that is born at less than 20 weeks and dies shortly after is not counted as an infant that has died, but rather as a stillbirth. Since we are doing health systems analysis, I decided to take a moment to talk about healthcare in Ireland. Healthcare in Ireland is primarily tax-funded. Just like here in the United States, individuals who work have a portion taken out of their check to help fuel the healthcare system. This results in a voluntary health insurance plan. Many of the citizens in Ireland belong to this plan. Copays are determined by how much money you make, and the government does its best to match healthcare funds. There is also healthcare that is free of charge. This is income-based and is only available for individuals who are at or below the poverty level. There is also a private sector available. This is for individuals who wish to pay primarily out of pocket and go to for-profit organizations for health care. Before I present my health initiatives, I'd like to take a moment to recognize the Ireland Institute of Public Health. The Ireland Institute of Public Health is responsible for the overall health and success of Ireland. Their collaboration with other organizations has laid out a foundation that will continue to thrive for a healthy Ireland. For my health initiatives, I decided to focus on tobacco control, suicide prevention and awareness, and alcohol control. My first health initiative is alcohol control. Ireland strives for a strong and healthy population. Overconsumption of alcohol is starting to interfere with this process. During the past decade, Ireland has seen an increase in liver disease, suicide rates, and hospitalizations, all attributed to alcohol consumption. The average alcohol consumption has since doubled since 1960, and treating alcohol-related injuries costs the healthcare system an estimated $1.2 billion. That's about 8.5% of the total annual healthcare budget. Since this pandemic is reaching catastrophic proportion, it is at the forefront of public health care initiatives. If Ireland were to reduce alcohol-related injuries, taxpayers would save an estimated $1 billion a year. That's about 30%. Still, it's not about the money. It's about the families who are affected by something that is completely preventable, that can be controlled and moderated. In order to control alcohol consumption in Ireland, it first begins with increasing awareness of abuse. Ireland set out to increase awareness through community outreach centers, treatment centers, peer consultant groups, and educational programs. This made it to where individuals who were addicted to alcohol could access any one of these resources to help them get through their addiction. Secondly, Ireland set out to raise costs of alcohol and alcohol production. Lastly, Ireland has implemented many liquor acts to control the consumption. The first is the Intoxicating Liquor Act of 2008. This makes it where you have to be a certain age to purchase alcohol, you have to have a liquor license to sell alcohol, and you cannot sell alcohol on certain days such as St. Patrick's Day or Easter. Suicide prevention and awareness is my second health initiative. This is a major health concern within the Irish population. The first reason is because suicide is the principal cause of death in men aged 15 to 34 years. Secondly, there is a great gender disparity. Men are more likely to commit suicide than women and are less likely to seek help in the midst of a mental breakdown. Lastly, rates rise every year. In 2011, there were 552 suicide deaths. That's 10% higher than the year 2010. Implementing suicide solutions within the Irish population first began by improving access to mental health services. Prior to the implementation of this solution, individuals who suffered from mental health illnesses had no idea where to go, who to turn to, or how to even seek medical attention for their mental health disorders. Secondly, to decrease suicide within the Irish population, the medical board set out to ensure follow-up for patients who presented with mental health concerns, whether it be at a primary care doctor's office, an emergency room, or a community outreach center. Individuals who presented with mental health concerns were required to have follow-up within 2 weeks. This would be ensured through the establishment of psychiatric care. The individual would be escorted over to that facility, and psychiatric care would be required to follow up with that individual. Lastly, Ireland has set out to increase multidisciplinary care among patients with mental health disorders. This involves your primary care doctor talking to your psychiatrist in order to ensure that you have safe medical attention for your mental health concerns. My final health initiative is tobacco control. Within the last century, through an analysis, the Irish Health Board has identified firsthand what overconsumption of tobacco products has done to its population. Overconsumption of tobacco products has been attributed to an increase in cancers, coronary heart disease, strokes, and hypertension. After this analysis, it was found also that 77% of adults started smoking in their teens or younger years. Because of this, Ireland has set out to control tobacco consumption amongst its population. Still, tobacco use continues to be the leading cause of preventable death in Ireland. Tobacco solutions are implemented in the Irish community in a very simple way. Solutions first begin with making it illegal to purchase tobacco if you are under the age of 18 years old. Prior to the implementation of this law, you could purchase tobacco at any age. Secondly, the medical board and government set out to control advertisements and increase health awareness of the negative effects of tobacco. Lastly, the medical board and government made it illegal to smoke in the workplace and certain establishments. This accounts for hospitals, bars, and restaurants. This concludes my presentation on Ireland. I'd like to take a moment again to restate my 3 healthcare initiatives: alcohol control, suicide prevention and awareness, and tobacco control. As you can see, all are population focused. They strive for the overall goal of Ireland, which is to ensure a healthy population.